My name is Dr. Eric Liu, and I'm a surgeon here at the Rocky Mountain Cancer Centers here in Denver, Colorado. Talking to your care team about your disease can be very, very challenging. There are lots of people involved in your care, and you may have a lot of questions. So let's spend a minute and talk about how to communicate about neuroendocrine. You have a team of people helping to care for you. You have a local oncologist. Hopefully you have a neuroendocrine specialist. But there are nurses, medical assistants, schedulers, many people who are working to help take care of you. And so communication is extremely important. So when you talk to members of your team, there are certain important pieces of information that you need to know, such as what kind of cancer do I have? In this case, it's neuroendocrine cancer. But you also want to know what stage is it? So how far is it spread? You want to know what grade is it? How fast is it growing? How aggressive is it? You'll want to know what kind of imaging techniques you need and when do you want to do them. You'll also want to know about prognosis, how long do I have to live, what complications you might have, and also you want to know what therapies are available and when do you want to use them. So those are a lot of questions that sometimes people feel intimidated by because they're big words. Obviously, a lot of medical lingo is not really in English. It's mostly Latin and Greek. So there's a whole new language that patients and caregivers need to learn about. But the most important thing for you as the captain of your team is knowing that you need to have good communication with your whole care team. So when I give advice to patients, and knowing it's very complicated, I always say you want to have an open line of communication with everyone in your team. You want to feel comfortable with everyone in your team. So that includes the specialist, the local oncologist, and the general practitioner. In those cases, spend some time. Tell them about your symptoms. I know sometimes it can be a rush and people are running around. I've had those days. But remember, that time is yours. And so if you have something that's going on, I can't help you if I don't know about it. And maybe it's not me. Maybe you spend a little time talking to the nurse and she can explain things to you. Or maybe you can express some symptoms you might be having that you may have forgotten about when you talk to me. Or if you have something else that comes up, you don't understand your scan, you don't understand your pathology, make another appointment. Talk about it, understand it. We always feel very strongly that if you as the patient have more information and understand your disease, then you can take control of it. And we can help guide you through that journey. Call my team today for an appointment.